Today I wanted to talk to you a little bit about something I don't think is rightfully understood about this epidemic that we are in the middle of opiate addiction and death, deadly, catastrophic, horrifying. It's also, I believe, one of the great forces for change, though, in the country today, and that's kind of what I want to talk about today. To do so, I want to talk to you a little bit about, tell you a story about a town on the Ohio River, Appalachian town, industrial town for many years, named Portsmouth, Ohio. It's right on the across from Kentucky, one of the southernmost parts of Ohio. It was an all-American town for many years. It had a bustling main street. It had a steel mill, had shoe factories, had a population of about 50,000 people, mostly working class. Nobody really felt poor because everybody was kind of like together and they saw each other. And one of the main places they saw each other was kind of the center of life, really, for Portsmouth, Ohio, was an enormous swimming pool, about the size of a football field. This swimming pool opened from about April to about October. It was really the center. It was where people kind of got together. People grew up at this swimming. It was a town babysitter. You could leave your kid there at 9, knowing that by 5 o'clock, pick them up again to be fine. People watched each other. The owner of one of the shoe factories in town also owned the pool, right? So he reinvested. He didn't need the money from the pool. So he just reinvested in bought more land, and soon there was places for picnic tables, football, for grass on which kids to play, basketball courts. And the name of this pool was Dreamland. At this pool, there always seemed to be room for more and more and more people. Class differences kind of melted away. You know, everybody looked the same in a pair of swimming trunks. The cycle of life repeated at Dreamland pool. So when you were 3, a toddler, you would be swimming in the shallow end with your mom. Then by high school, you'd be jumping off the diving board. Your mom would be off with her friends over here in the big grassy areas. You'd lose your virginity out in those same grassy areas, and then your kid would as a toddler, would be in the shallow end of Dreamland pool. It happened over and over throughout many 50 years or so of life in this town. In 1980, began a period of decline for Portsmouth. The steel mills left. Shoe factories closed. Main Street couldn't hang on, so a lot of those businesses just went out. Half the population left Portsmouth, Ohio, and a lot of old houses and brick buildings just stood empty. 1993, without any support, Dreamland Pool was dug up and replaced by a sea of asphalt and a strip mall, and the people who remained turned indoors. They had no place to commune, to be with each other. Walmart replaced Dreamland as the place where you most likely see somebody else. The end of Dreamland really spelled the stripping away, of community in Portsmouth, Ohio, leaving it kind of without a societal immune system, and this allowed a pestilence, a wave of opioid painkillers. The reason I went to Portsmouth, Ohio, is because it was very important in the beginnings of this opioid epidemic, because it was the place where the pill mill was invented. All these little clinics, shady clinics with doctors prescribing for cash, huge, catastrophic amounts of narcotic painkillers. It was really among the places that led the country into this opioid epidemic that we are now now it's roughly its 25th year, and most pervasive and deadliest drug scourge in our nation's history. It is a catastrophe what we are facing as a country. There is absolutely no doubt about that, and it is coast to coast. But as I've traveled this country since my book about this epidemic came out in 2015, I've gone all over, North Carolina to Oregon, to Hawaii, to Vermont. And I can say this, that this epidemic indeed is one of the great forces for change, for rethinking how we do things in this country. It is that way because, excuse me, it affects so many parts of our country. because it's also in Orange County, it's also in suburban Charlotte, banking center. And that is because it didn't grow from economic devastation. It grew from our own isolation. That's the common denominator all across the country is isolation, not economics. Isolation is about all that Portsmouth and Orange County have in common. It's such a force for change because it is so deadly, deadliest ever. We lose more people, in the past few years we've lost more people each year than the entire number of Americans who died in the Vietnam War. And that is for that reason as well, that is forcing on us a whole lot of new ideas, challenging old ways, I think, of thinking. It's questioning, I think, whether we can, given American corporate marketing, whether we can ever really legalize drugs, where that would be a safe thing to do. After all, this began with legal drugs. It's questioning whether we can actually stop the drug flow by building yet another wall along the border, not far from here. Because we are living in a time of the cheapest, most potent, pervasive drug supply that we've ever known as a country, and almost all of that is coming through walls. It's showing us at the same time that the future is in the underworld is in synthetic drugs. Plant-based drugs do not make a lick of business sense when you can make all your drugs with a bunch of chemicals in a laboratory. And those chemicals are now readily available from companies in China, increasingly India, and elsewhere. And this potent, cheap, and prevalent drug stream on our streets will be our reality from now on. Whatever we do, whatever solutions we propose, has to take into account the fact of methamphetamine, fentanyl, and other synthetic drugs. It's also posing to us the idea, I think, that we have reached the end of the idea of recreational drug use. Recreational drug use is an idea that I grew up in it myself. I'm 61, in the 70s and 80s. That you could do a line of cocaine or smoke a joint, the guy passes it to you at a party, no problem. Those days are now over. Those drugs are likely to be laced with all kinds of potent stuff that we have no idea. But it's a daunting panorama that we see all across this country, I think. But it's also really, really exciting, too. One thing I've noticed as I go from county to county to county, and again, in North Carolina and Indiana, Wisconsin, Pennsylvania, Oregon, et cetera, every place in this country I've found the same response. And that is these groups forming. You know, you call them task forces, you call them working groups, collaborations, blue ribbon, whatever the heck you want to call them. It's all kind of with the same idea. They are forming in response to this to find a local response to this. And unlike such responses in the past, it's no longer just parole, probation, judges, cops, sheriffs, jailers, all that stuff. It's those guys, but it's also PTA, clergy, Kiwanis Club, Little League coaches, college presidents, doctors, hospital administrators, on and on, recovering addicts. This issue is a fascinating thing because it's the only issue in this country today that is truly major social domestic issue that we face as a country that is truly bipartisan, that does not send everybody to their red or their blue corners without ever to return. What I like about these groups that I keep seeing forming all over is that they didn't wait for the pilot project, you know? They didn't wait to say, okay, what are the 10 bullet points I need to follow, right? No, they just said, screw it, we're just gonna do it. I was really into punk rock when I was a kid in college, right? The ethos of punk rock was just do it yourself. Before Nike took just do it, it was the punk rock community that had that idea. And that's what these groups are very punk rock. They're just doing it, not waiting to be told that they can or how to. Yeah, they fumble, they stumble, it's messy, but all that's okay, that's good. Because in an era of abuse of the most isolating class of drugs that we know as a species, we are seeing Americans come together, and you're seeing it in county after county, and it's an exhilarating thing. And I urge you in the counties where you live and work to be part of this. Help these groups out, add to their energy, add your own expertise. It's showing, this epidemic is always showing that, yes, we cannot arrest our way out of this, but we also can't treat our way out of it either. Prevention has to be a major focus of what we do. Certainly, we cannot treat our way out in a time of this fierce drug supply that is so potent and cheap and synthetic. In a time of these drugs on our streets, this epidemic is challenging the idea that I've heard expressed from time to time, that jail shouldn't be necessary. In such a time, addicts need to be pushed into treatment. Otherwise, people die. It's not so much the true case out here in California, but in other parts of the country, nobody has ever known a long-time fentanyl user. They die quickly. The idea that all addicts will just check themselves naturally into treatment if there's enough treatment beds to go around, I think amounts to a death sentence, and I've seen it happen way too often. This epidemic is suggesting that the jail must be a place of recovery. Transforming jail is therefore essential, and this is happening. It's exciting to watch this take place. Kentucky, by the way, is one of the leaders, and largely because I think Kentucky is the only state that elects its jailers, and therefore they're very accountable. But jails around the country are transforming parts of their jail pod into recovery pods. Again, it's messy, it's stumbling, it's fumbling, but it's a healthy step. It's a healthy step forward. It needs to be pushed by folks in social work or in public health like you all, and not just by folks in law enforcement. Traditional jail, the way jail has always been done, has been such an anchor around our necks. It's fostered crime, addiction, mental illness. You change jail, and I believe you change the country in important, significant ways. And I believe doing that is another of the great lessons that this epidemic is showing us is necessary. Along with this epidemic, brain science. Brain science is going through a golden age right now. We know more about the brain now than we did 20 years ago, and we still need to know a lot more. The brain and the universe are the two most mystifying things we know as human beings. But nevertheless, it's showing us the importance, certainly as the brain recovers from addiction, in nutrition, good nutrition, and exercise. And too often, all across the country, you see treatment centers that have people are sitting around, they're drinking sodas, they don't exercise, they don't treat the brain. And that's what we're talking about here when we're talking about addiction treatment. But perhaps I think the most exciting, important idea that this epidemic is pushing is this: that what is now needed is a continuum of care for addiction. Like hospitals and health systems, they just don't provide surgery, which is very profitable. They plow a lot of that money back into, so you get outpatient, you get ERs, you get orthopedics, you get physical therapy, all these different ways in treating people after surgery, right? It's a continuum of care. It's looked upon, it's largely medical in focus, because that's what this is all about. But it's also about nutrition. It's also about a daycare sometimes. Too often when it comes to addiction, this is simply not being practiced, largely because addiction is kind of like this stepchild, relegated, and the stigma is so intense regarding it that no one really cared too much about how to treat it. The first 90 days are certainly the most profitable, but this epidemic is showing us that if that's all you do, that is not enough. That is just not enough. It can be the dispensing of Suboxone or methadone, which are handy tools, wonderful tools, always should be viewed as tools. But again, just doing that alone, again, is just not enough. It does nothing to help with the basic issue of life repair. Right? This epidemic is showing us that a continuum of care, similar to what diabetics or cardiac patients receive, is what this is calling. And the only difference is that this care, when it comes to addiction, is very, very different. And in that regard, I'd like to return to the story of Portsmouth, Ohio. Because what's happening in Portsmouth, Ohio is really fascinating to watch. The town that led us into all this, it's fascinating to watch what's going on there now. One of the towns, One of the ways this began is through an organization called the Counseling Center, which began as a small house about the size of this stage I'm standing on right now. Right? Many is in like the late 80s, early 1990s. Today, it has expanded into becoming, and is now one of the county's largest employers. It has, yes, detox. It has Suboxone treatment, sure. It has acute residential care for 90 days or what have you. It has sober living houses for folks after those 90 days. It also has one of the most interesting parts of it is that it's got housing for pregnant mothers. So that if you have a child and you get pregnant again, while you're addicted, you can check into this house, and your baby that's waiting to be born will not end up in the NICU. You have an explosion of 12-step meetings. Every day of the week, several times a day, you can find a 12-step meeting in Portsmouth, Ohio somewhere, at a church, YMCA, whatever it happens to be. But you know what's fascinating about the story of Portsmouth nowadays, this town that led us into all this, is that continuum of care involves a whole lot of other things that you wouldn't perhaps thought of. One of them is CrossFit. It's an essential component to recovery is exercise, I believe. First, CrossFit involves a lot of hard exercise, and that helps the brain recover. But it's also because CrossFit is done in community, not alone. It's people working together to get into shape, you know? Encouraging each other, pushing each other, learning in small and daily ways through community, through working with each other, that they are capable of things that they never thought they could do while they were in addiction. Addiction is all about what you can't do. CrossFit is all about what you can do if you show yourself you can do it. The town now has 4 CrossFits, including one that's an outbuilding of Dreamland Pool. They call it CrossFit Dreamland. It's about recovering addicts working out together. A town with a horrible problem of obesity. Now this is kind of like an insurgent outpost here. But the counseling centers also added a whole lot more than that I find fascinating to watch every time I go down there. First of all, they adopted the idea that these folks are untouchable by the private sector. The private sector won't rent to these folks, loan to these folks, employ these folks. So a nonprofit's job is to ready them so that they are acceptable to the private sector. These are folks who have done such damage to their lives. They don't have anything that would allow them to actually function in the real economy, and that is what keeps them in addiction often. So the counseling center has adopted job training programs, taking folks multi-week, and can't remember how many weeks, but carpentry, plumbing, drywall hanging, landscaping, construction. As they did that, folks at the counseling center began to realize, you know what they also need? Driver's licenses. In addiction, they have lost their driver's license. Well, you cannot function in this economy without a driver. It's our ID. It allows us to drive, et cetera, et cetera. And that lack of driver's license has also kept people in addiction, segregated from the real world economy and existing hand-to-mouth in the under-the-table economy. When they did that, they also began to realize you can't get a driver's license if you still have fines, traffic fines, probation fines. So the whole idea is you got to work towards getting these folks. This is the continuum of care, right? Just like a diabetic with insulin and meetings with the doctor. This is different, though, right? Paying fines. The amounts of fines that these folks had over their head kept them living like survivalists. No bank accounts, no over-the-table economic employment. It was just all survival, kind of finding ways of getting money here, money there, walking a lot. And when they got to that point, the center began to hire many of these folks. So they actually developed a job history of some kind, because a lot of these folks have several years in which is just a gaping hole on their resume. And finally, when I was just down there recently, they told me, now what we've done is open a line of credit with a bank. So the guys, once they've done all this, paid off their fines through their work, they get their paychecks garnished at work, they pay off their fines, we help them get their driver's licenses back. Now that through this line of credit that we're offering, they can pay off a car. They're forming at the counseling center new nonprofit companies that are, again, training people in work, having them do work, profit-making work that allows them to develop a work history. And the next is landscaping, and there's a used car lot that just went out of business that they're hoping to turn into a mechanic's shop. Again, all of this is to prepare folks to be acceptable risks for the private sector, because that is part of what really has to be viewed as a continuum of care for people who are in addiction. The Portsmouth case is a tough one to replicate. First, it's entirely due to a Republican governor having expanded Medicaid under Obamacare in spite of a Republican-led legislature. Took that very daring step, and that's why all these people have addiction treatment covered. But it's also in a bizarre way due to Portsmouth's own decline. For the counseling center has occupied 4 dozen, I think it is, abandoned, derelict buildings that were standing empty for the last 30 or 40 years. It now, one building is even an old stone elementary school. There's 35 shuttle vans shuttling people. It's very inefficient. They need to find another way of doing it, but that's the way it was possible in Portsmouth. These buildings are often renovated by recovering addict workforce that the counseling center has trained. This is kind of what the continuum of care looks like, and it's what this epidemic is asking us to consider, is suggesting that we need to implement all across this country. From overdose to occupation is the way one guy put it. So whether or not addiction is a disease, and I have to frankly say that I find that debate to be more alienating. We alienate each other when we start arguing about this. Addiction must certainly be treated as if it were a chronic disease, like heart disease, like diabetes. It underlines one of the most important lessons that we can learn from this most damaging drug scourge in our country's history, that you achieve nothing without community. Working like this goes nowhere. This is where you want to go, it seems to me. This is what this epidemic is showing us. Epidemic exists because we turned our back on that idea. We thought we could all just go it alone. But you know, in Portsmouth, the story gets even more remarkable, I think. Addicts from all around Ohio now are coming down to Portsmouth to get clean. The town that led us into this morass is leading us out of it in a fascinating way. These folks are asking their judges, their probation officers, please send me to Portsmouth. Because no place in Ohio has achieved that continuum of care that Portsmouth now has. So they've come down, kind of riding into town, hollow-eyed, stained, desperate, like some strange cavalry to the rescue, and turning to this bedraggled, beaten down town as a last resort. What's more fascinating as well is that they are staying in Portsmouth. They don't want to go back home where they know all the dope dealers, right? They want to stay. They got a recovery family here. They're building this recovery family together. They can feel that they add to that. It's not enormous. This is not an enormous group of people, but it is an important one. And they are afraid to leave it. I've seen this many times. Meanwhile, they are rebuilding the town with their new skills and with their newfound energy. Downtown Portsmouth is returning to life after years and years of abandonment. A recovering addict workforce is rehabbing the century-old buildings, houses that have languished for decades now. What's more, these folks are filling in the gaps created when all those factory workers left in the 1980s. And recovering addicts increasingly are being recognized as a precious new natural resource that the town didn't know it had. New people filled with excitement for a future, gratitude for a second chance, glad they're not dead, desire and filled with a desire to be part of something instead of just walking through life invisible behind that, hidden in that hoodie. All of this, of course, coexists with a deadly, deadly drug problem in Portsmouth, Ohio. People are dying at high rates from fentanyl. Switching to meth is some kind of harm reduction strategy. I won't die if I'm on meth. But that, too, seems to me as a part of the story we should not ignore. That policy shares something in common with addiction, and that is progress and failure coexist together. Probably always have. It's always messy. It's always stumbling. It's always human. It's good. There are no magic answers. There are no silver bullets. It's just about daily work, innovation through immersion, incremental moves towards something much larger. Portsmouth and its drug addicts, each forgotten, each written off, are now each fighting their way out of decline and turning to each other for support, turning to each other as a last resort. It's a remarkable story. One of the reasons I love being a journalist. Addicts are redeeming the town they find, and as they find redemption within it, they together are offering Ohio one way out of this. I get very choked up sometimes when I think about it, but as I travel around the country, it's this story alone that is enough to show me why this epidemic is such a force for change and why we ignore its lessons at our peril. Thanks very much.